Right. So, admitting officer, emergency department. Okay. The is not necessary. The is not necessary. Just write admitting officer, emergency department. D, capital letter. Emergency department, Newtown Hospital, 13 November 2014. Dear doctor, T should be straight. Regarding Miss Sally McConville, this is not clear. N is not very clear. V is not clear. It looks like U. So why this difference? So McConville, aged 38. Yeah, fine. So Miss McConville, comma, no space before. No need space before. Space is needed after. Miss McConville, who was diagnosed better. Better who was diagnosed. Who was diagnosed with acute asthma and so here okay. So any one you can take. So diagnosed with acute asthma is enough. Okay. Who was diagnosed with acute asthma and whose signs and symptoms suggest pneumonia. So this you can write in the next paragraph. Or whose signs and symptoms suggest pneumonia. Whose signs and symptoms are suggestive of pneumonia. So like that, anything you can write. So you can leave this part. You can write it in the main body. Or you can use this one here. Anyone diagnosed with acute asthma, that you can say, or whose signs and symptoms. Okay, diagnosed with asthma, pneumonia is more important, you write pneumonia. Whichever is more important, you write here. Requires urgent admission. Urgent admission regarding pneumonia or asthma. Okay, that's urgent admission and appropriate intense management. Fine. So here you can say requires an urgent admission. Okay. An urgent admission, an admission. You can say like that also. Otherwise also it's okay. The appropriate intense management. Today, Miss McConville presented with exacerbation of breathlessness in spite two different words. In spite two different words, or in spite of three different words, or you can say just a despite one word, despite one word, or you can say in spite of any one, you can say any one of them, in spite of or despite, 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 despite taking medication, prednisolone and antibiotics. On examination, X is not clear, A is not clear. Let us write clearly. On examination, labored, B is not very clear. Labored breathing along with tachycardia, tachypnea, and fever. Labored breathing, then labor breathing along with, so there should be has been noticed. If you say and, there is only one thing. Labored breathing has been noticed along with tachycardia. So it should be has been. If you say along with, and here only one thing, labored breathing, so it should be has been. Has been, not have been. Why? Because along with, outside the area, labored breathing has been noticed along with tachycardia, tachypnea, and fever. Those are three different things. This was along with. You cannot say this were along with. Labored breathing is along with, so has been. So try to understand the points there very clearly. Okay. Has been noticed. Full stop. Chest auscultation. Where is S? S is not clear. S and C. Okay. Auscultation. Don't write in this place. You're always writing in this after the line. Don't write. Don't write in this margin area, please. Chest auscultation revealed. A is not clear. U is not clear. It looks like V. Widespread V's and basal crepitations, which aroused the doubt of pneumonia. Okay. Crepitations, and therefore pneumonia is suspected. You can say like that instead of doubt. To arouse the doubt of pneumonia. This is the reason for the emergency referral spelling mistake. Write 10 times. Referral, write 10 times. It is there in the case notes also. You could have written correctly, na? If you see the case notes. Okay. It is A. Referral, not E. It is A. Referral. Initially on 10 November, initially, comma, on 10 November, comma, Miss McConville presented with a two-day history, hyphen, 2-day. 2-day history of running nose or runny nose. What do you mean by running nose? It is not running nose. It is not running nose. It is a runny nose. Yeah, runny nose. A runny nose, not running nose. How can you write like that? Running nose means where it is running. It's runny. It's an adjective, not a verb. Okay. Runny nose. Runny. RUNNY. This nose symptom is called as runny nose, not running nose. So be careful. Runny nose, productive cough and fever. She was diagnosed. She was diagnosed with viral upper respiratory tract infection due to maybe, okay, exacerbation of asthma. Asthma exacerbation. FRUCT. It looks like that. Careful your spelling. Infection with asthma exacerbation. Is it upper respiratory following asthma exacerbation? Okay, two are there assessed. You can say and asthma exacerbation. Okay, for which then you have to put a comma here. Therefore, for which means you have to put a full stop. Otherwise, therefore, or consequently. Okay. If you want for which, then these are two mistakes actually. Two mistakes you have done. So you can do like this otherwise. Comma, for which, like this you have to write. Comma, for which. Comma is missing, not full stop. Full stop is not right. So, for which Ventolin puffs 6 times a day. Ventolin puffs 6 times a day was prescribed. Ventolin puffs were prescribed, or Ventolin 6 times a day was prescribed. If no puffs, then was prescribed. If puffs is there, okay, Ventolin 6 times a day. If this is not there, then your answer is correct. Ventolin 6 times a day was prescribed. But when you say Ventolin puffs were prescribed, okay, be careful. 2 days later, she not represented. Represented is different and represented. or you can say she presented again. She presented again. Represented means I represent the teacher community. It means I am the leader and I am representing, not representing. Representing and representing. Representing means on behalf of somebody. The headmaster is representing so and so school. On behalf of the school, the headmaster is coming. The dean represented the university. So that means on behalf of the dean, the dean has come. So in the same way, but represented means you're coming on behalf of somebody, but represented means presented again. So if you have a confusion, you can just write she presented again. So like that you can write if you have confusion. Otherwise you have to say represented, re-presented. So this is also right. Okay. Either this or this. So represented is correct or presented again is correct. Any one you can take. 2 days later, she represented with deteriorating asthmatic symptoms. With deterioration of, or you can say deteriorating asthmatic symptoms. With the deterioration or deteriorating is better. With the deterioration of asthma or with the deteriorating asthmatic symptoms, and was recommended to continue Ventolin puffs along with amoxicillin XI. Amoxicillin spelling. Here X is not clear. This is looking like W or M. Points are there. Okay. It should be cup shape like this, and you are doing point shape. It should be a cup shape like this one. Cup shape. The inverted cup shape. And comma should be immediately, not after this one. Okay. Comma should be immediately there. Okay. Thrice daily and prednisolone. 25. Where is space after comma? Why there is no space before? Why there is space before comma? Why there is no space after comma? 25 mg. It looks like Y. Your G looks like Y. Why? Why don't you close that one? Daily for 3 days. Okay. She has a history. She has a history. A history of asthma, hypertension, and depression. Okay. Currently, she is on Ramipril to 2.5 mg or 25 mg. Where is G? Daily. Paroxetine. Confusion. R and X. 20 mg daily and fluticasone. Is it A or U? 250 mg, 2 puffs daily. Right. She is on. You can say the current medications include. Why she? Every time you are using she. How many times you are using she? She. Okay. Her. Right. Avoid this she as far as possible. She. She. Yeah. So you have to reduce that she. So the current medications include Ramipril, paroxetine, and fluticasone. Okay. It would be appreciated. It would be appreciated if you could admit her in your facility for assessment immediately. Is an emergency letter. Immediately. Into your facility for assessment and specialized interventions. Good. In case, comma, in case comma, any additional information. Any additional information is deemed extremely relevant, comma, put a comma here. I can't see any comma here. Relevant spelling. V-A-N-T, you wrote E-N-T, I think. Okay, comma, where is comma? Relevant, R-E-L-E-V-A-N-T, comma. Relevant. Please do not. Your N is not clear, H is not clear. Why this bending? Should be straight. Your T is bending, your T is bending. Huh? Please do not hesitate to contact me. Okay. Yours faithfully. Yours faithfully, comma. Admitting officer, yeah, yours faithfully. After yours faithfully, you have to put a comma here. Okay, A is looking like you. This and this, no difference. A and U, no difference. Okay, Y and G, no difference. I don't know why you are writing like that. Okay, registered nurse. Okay, that's fine. Handwriting, focus on your handwriting. My suggestions to you are, okay, number 1, some letters are confusing because the bend or something. Okay, some letters are confusing. Right. Clarity is missing. Fine. Next. Space, no space before comma. Number 2, no space before a comma. Instead, the comma should be after, the space, okay, right, no space before a comma. Right. Number 3, a single letter space should be left after a comma. Okay. Then be selective with the letters. Number 4, be selective with the letters. Choose only nursing letters because medical letters are little bit complicated. Okay, you can learn from others, but you cannot write because that is little related to doctors. So some medicine, some treatment, okay, 15 to 20% powerful it will be. Next one, number 5. Number 5. No need of definite article in the address. It's understood. See, everywhere space before comma. This, if you put here everything, there is equal space here and here. Here half space, here half space. Instead of that one, put here so that, okay, it is single letter space. Both the sides no need, only one side is needed. F, don't touch the above line under any circumstance. Okay, don't touch this line. And right, start from here. Okay, all this area you have taken care, but sometimes you're going inside, see. Right. See, this M is not clear, just like ON or OV. Okay, clear. C and I combined. Okay. This looks like G for me. Here H looks like G for me, capital G. This N, A is looking like U. Okay. So focus on these areas. That's very clear. So fifth point. Okay. Maintain uniform font size. Okay. Your handwriting is good. Okay. Handwriting is good. Right. Handwriting is good, no doubt regarding that. But the thing is the bends, the curves, and the clarity have to focus. T and I look like H. So the N looks like U. Be careful regarding these things. Right. Okay. So file, save. Yeah. Yeah. So this letter is corrected. Sreeja Raveendran. Sally McConville. Yeah. So Sreeja Raveendran, you have 1 minute. You can ask any doubts if you want. Hello? Yes, Sreeja. Sorry. Unmute.
Hello. Yes, sir. Good morning, sir.
Good morning, dear. So regularly write letter like this and immediately get back to me like this and I will correct and give you, okay?
Okay. Thank you, sir. Thank you very
Yeah.
much, sir.
Yeah. Do you have any doubts in this letter now?
Yeah, that's the first, sir. I wrote who has been. So you told me was diagnosed. What
Yeah,
is the difference?
that has been diagnosed means either present perfect. Okay.
Mm.
Okay. It is present perfect. Was diagnosed is past simple. Okay. Was simple. Has been diagnosed means present perfect means today. Right?
Okay.
Is acute asthma diagnosed today?
Yes, sir.
Sometime back, right?
Yes.
Okay, sometime back, maybe yesterday, day before yesterday, or in the morning, or whatever. Okay, so diagnosed, try to use simple past tense as far as possible, unless and until you are sure that it happened now or today, just now.
Okay,
Has
okay,
been
sir.
present perfect means just now finished, just now
Okay,
finished. Okay, I have
okay, sir.
eaten. I see. You called me for dinner. I came, I ate, I washed my hand, and you are asking, what did you do? I have eaten my food, means just now finished. You understand now?
Okay, sir.
Just now completed. Did you do it just now? No. Correct or
Mm.
not? Sometime back, maybe 1 hour back, maybe 5 hours back. Just now, at the time you are speaking, when you completed, then it is better to say has been diagnosed, has completed, or has been completed, passive. I have eaten, food has been eaten. Present perfect means just now completed. You understand now?
Okay, sir. I got.
Uh,
Okay, sir.
so sometime back completed means past tense. Is that clear?
Mm.
Hmm?
Okay, clear, sir.
Okay, fine, fine.
Okay.
Any more doubts?
Yeah, everything clear, sir. Thank you, sir. Thank you very much.
Okay. And
Okay.
any other letter is pending for you?
Previously, I sent some letters, but that.
Okay. Can you just tag them and give me afterwards? I'll correct. Okay. Whenever I'm
Oh,
free, I'll correct. Okay.
okay, sir. Okay, sir.
Okay. Fine. Fine. Thank you very much.
Thank you, sir.